The first speaker is Dr. Li Shu-kin is actually a very good friend and classmate of me, and he's a cardiologist in private practice, before which he was served in the private sector for more than 30 years and graduated from after graduation from medical school. He's currently the Honorary Clinical Associate Professor in the Faculty of Medicine of the University of Hong Kong, and also the Honorary Consultant Physician of Palmer Road Leicester Eastern Hospital. His main interest is complex coronary interventions and critical cardiac care. Through teamwork, Dr. Li and his colleagues of Hong Kong College of Cardiology continues to promote the awareness of sudden cardiac death and the use of automatic external defibrillator in the community. He's currently the president of Hong Kong College of Cardiology. Could I invite Dr. Li to the podium?
Thank you, Gary. I would like to thank your association and the organizing committee to have invited me to participate in this interesting meeting. And I have to find my slide first. To set a stage for the subsequent speakers, I would like to give you an overview about exercise and the relation on sudden cardiac death. In fact, the things I want to go through is about like this agenda here. So how common is it, and how does sudden cardiac death happen during or soon after exercise? And what kind of heart diseases may result in sudden cardiac death and on exercise? Are there any special exercise may trigger more sudden death than the others? What is the major immediate management one need to do? And is it risky or is it safe to do exercise at all for the heart? So it's long been known that strenuous physical activities can give rise to sudden death or tragedy outcome, like this legend behind the story of marathon. Sports-related sudden death is usually defined as a sudden unexpected death during or soon after exercise. Some would take up to an hour after the physical activity. And usually, because trauma is responsible for most of the sports-related death, so we only count the non-traumatic one. Cardiac cause is a major cause of those sudden death, but not the only cause for these sudden tragedy, because other causes may include severe asthma, hypothermia, and cerebrovascular accidents. So like this pie chart here, which is a report from the U.S. National Collegiate Athletic Association for the cause of death of the athletes. But mind you, this is the figures is not confined to sudden death. So you can see a majority of the death of the athletes are due to accident and some other unnatural death. For medical diseases, cardiac cause is responsible for majority of the death, especially for the sudden ones. But how common is it? Of course, sports-related sudden death attracts a lot of attention from the public, particularly the media. But how common is this event? According to different epidemiological study, the incidence varies in different reports. Like in the U.S. high school and college athletes, apparently it's more common for the male athletes, but it's still quite infrequent. It seems to be more common in Italy, but this report actually included all events not confining to cardiac cause. And in some sports center like the YMCA in US, they reported one acute event for every nearly 3 million person hours of physical activities. It can be quite frequent in certain areas, as they reported one death per 7,000 joggers for each year. But if we count only those apparently healthy ones, the incidence may be half. But on the other hand, in some reports about the marathon, it seems that cardiac arrest during marathon or half marathon is not that frequent. So the epidemiological reports actually quote various incidents. Because the chance of occurrence of sudden cardiac death is still quite infrequent, that's why the incidents quoted are so variable. In fact, from the different countries, they also reported the incidence varies according to different era. Like here in Italy, the earlier incidence of death, sudden cardiac death appears to be higher, but after they introduced certain screening procedure, apparently they cut down a lot of certain untoward events. But the experience was not reproducible in some other countries like Israel and United States or Denmark. But what you can see from all these reports here, that the incidence of sudden cardiac death related to physical activities is not that frequent. But how does it happen? Note, in simple terms, the circulatory system is only a pump connected to the lung and various organs with a lot of arteries and veins. For the cessation of this circulation, either there's disruption of the artery like the acute aortic syndromes, or the pump suddenly cease to be functioning due to sudden disturbance in the rhythm. An organized heartbeat usually come from, we have atria and 2 ventricles. And for each heartbeat, electrical signal generated from the right atria and cause a contraction of both atria to push the blood down to ventricles. And the electrical signal then go down to the conduction system to both ventricles, and then cause the ventricle to contract and push the blood through the great vessel, and for the left heart to the whole of the body. For the right heart, it again pump the blood to the lungs for gaseous exchange. For certain rhythm, the pump function is very minimal, like this, what we call ventricular tachycardia. That means the signals are entirely from the ventricle itself, and the pump is contracting very fast. Because there's no time for relaxation, so no time for enough blood return to the heart. And from these, there's not much blood pumping out from each cycle of the heartbeat. And to more extreme, it comes to, in cases of ventricular fibrillation, that the rhythm is totally chaotic, and actually the heart stands still mechanically. So for these rhythm, there's usually insufficient circulation to the body and even to the heart itself, and sooner or later the person will collapse. So the first cardiac rhythm documented at the time of sudden arrhythmic death is usually ventricular tachycardia. And seldom or only in a minor of cases, they have a slow heart rate or bradycardia. And some are actually in VF, ventricular fibrillation to start with. For torsades de pointes, it is a special form of ventricular tachycardia we'll mention a little bit later. So why do exercise stress cause arrhythmia? So in this complex diagram, maybe I take you through slowly. So during acute exercise, we know that there will be exciting of the sympathetic system and withdrawal of the parasympathetic activities. That causes an increase in heart rate and the systolic blood pressure. That obviously will demand more oxygen for the heart muscle itself. So on the other hand, the increase in adrenaline or in prolonged exercise, particularly with poor rehydration, then this will give rise to irritability of the heart muscle cell. So for the heart muscle cell, they already at increase in demand of oxygen and become irritable. And if the perfusion is also in trouble, particularly at the peak or soon after exercise, we have a dilatation of all the blood vessels. And if the a person suddenly ceased strenuous activity, there may be certain drop in the blood returning to the heart, and thereby less blood coming out to the heart itself, and cause low blood pressure and low blood supply to the heart itself. So there's a critical imbalance of the oxygen supply and the oxygen demand, and that gives rise to ischemia or lack of blood or lack of oxygen for the heart muscle cell. And therefore, they will have an increase in chance of developing abnormal rhythm. So these only form the triggers. So what are the bombs? So without bombs, with these triggers, there may not be any explosion. So for heart diseases that is associated with sports-related sudden death, we usually define into two groups of people. For younger victims, like take 35 as a cutoff, majority of them have heart muscle disease, particularly hypertrophic cardiomyopathy. Some other heart muscle disease I will mention later, like myocarditis or other form of cardiomyopathy. The second most common causes of sports-related sudden cardiac death may be coronary or abnormal coronary artery itself due to the congenital reasons. For older adults, the major cause of sports-related sudden cardiac death will be coronary artery disease. So here in this picture, I give you an impression about the prevalence of various heart disease according to age. So in older persons, majority of the events are due to coronary artery disease, whereas heart muscle disease, they are more predominant in younger victims. And other primary arrhythmia, they only accounts for very few cases of this sports-related untoward event. For coronary artery disease, the majority of them are due to atherosclerosis. These plaques accumulate with time as we get older, particularly if one had high cholesterol or diabetes, particularly with certain bad habits like smoking. The artery will become narrower and narrower with time. But one does not need a very narrowed artery to precipitate a heart attack. That explains why the heart attack victims, up to 70% of them, never have any chest pain before the heart attack itself, because the artery before the event is still largely patent. But these plaques may be disrupted by at a certain time, because these plaques are subject to, for each heartbeat, the turbulent flow across the plaque. And when the plaque have disruption of its superficial layer, then the body response will be, there will be deposition of platelet, which is important in helping us to stop bleeding when we have wound. But this time they're not helping us at all. If they accumulate on this disrupted plaque and attract the clotting factors within the bloodstream, and they will form a clot immediately, and then the whole vessel will be closed down by this clot. When the artery is closed by this clot, obviously there will be lack of blood supply for this area of the heart muscle, and this is the mechanism of heart attack in most individuals. Apart from coronary atherosclerosis, if one have coronary anomalies, they will also cause ischemia at a certain time, at the peak time of exercise. Normal coronary artery runs like the right coronary artery arise from the right sinus of Valsalva, and the left arising from the left side, and it hook behind the pulmonary artery. But certain anomalies are predisposed to this sudden event because they run an abnormal course in between these two big arteries. For certain individuals, part of this coronary artery, they are not running on the superficial or the surface of the heart, but they go through like a heart muscle tunnel. And for each contraction, the tunnel actually narrow down. But this is all right for if the heart rate is not fast. So for certain individuals, when they have high levels of exercise, they may experience a lack of oxygen. For heart muscle disease, hypertrophic cardiomyopathy is responsible for the majority of the heart disease causing sudden death related to sports. This is the very much thickened heart muscle in compared to the normal ones. There are other forms of heart muscle disease apart from hypertrophic cardiomyopathy, like dilated cardiomyopathy, or the heart muscle inflammation, what we call myocarditis. Not so common in Hong Kong or this part of the world is the arrhythmogenic right ventricular dysplasia. It's degeneration of the heart muscle cell and change into fat tissue, and the right heart particularly would dilate, and sometimes it affects the left heart as well. It seems to be more prevalent in Southern Europe. For acute aortic syndromes, like people who are having Marfan syndrome, because of their connective tissue in the layers of the aorta become weaker, and they when they subject to the high shearing stress during exercise, these may form a false layer, and if this suddenly rupture, it may cause a tragedy outcome. So abnormal rhythm itself also causes sudden death. Even the macrostructure of the heart can be normal. In some, they are due to conduction system abnormality, can still be seen by histology, but if for certain, what we call aortic channelopathy, they are actually, the abnormality is on the cell membrane itself. So this explains the Wolff-Parkinson-White syndrome because they have an additional accessory pathway that may give rise to abnormal resting ECG and cause the abnormal circus movement tachycardia, but particularly dangerous when they have atrial fibrillation because all the chaotic signal will be conducted down not only through the normal pathway, but can also coming down through the abnormal pathway, and so that they have a high bombardment on the ventricle may end up into ventricular fibrillation. So-called channelopathy, because the heart muscle is electrical, they have electrical activity and they're subjected to electrical stimulation as well. So it's important for this ionic channel to be functioned normally, like the sodium channel, the potassium channel. If they function it is abnormal due to genetic reason, like either the increase in function of the sodium pump or loss of function, or particularly to the potassium channel. Again, these individuals may have abnormal resting ECG, and again, they are predisposed to the sudden arrhythmia, particularly like in the long QT syndrome, they may be having this special form of ventricular tachycardia, what we call torsade de pointe. This is actually a French, means a twist at the point. The electrical signal apparently becomes larger and smaller and become larger again. Another well-known form of this ionic channel arrhythmic event is the catecholaminergic polymorphic ventricular tachycardia that typically associate with exercise-induced ventricular tachycardia. But all these channelopathies are quite rare. So does the type of sports matter? Yes, because some sudden cardiac death need not have any cardiac problem at all. So what we call commotion cordis is usually described in a younger individual, either hit by a small object forcefully, and then excuse me. So when the small object hit forcefully on the chest wall at a suitable moment, that is, because for the heart, it needs to be relaxed and recharge itself after each heartbeat. So at a critical moment, when the heart is recharging, if it hit by a certain strong force, this will precipitate abnormal rhythm and cause the ventricular arrhythmia. So this may happen only in younger individuals where they have a soft chest wall. So for other forms of sports, like here reported in France, apparently cycling is associated with more sudden death, followed by jogging. But is cycling that dangerous? Well, if you see the reports from Germany, actually football is the more common cause of sudden cardiac death, followed by running. So it all depends on your locality and your people, what kind of sports you're fond of. So actually in colder countries, snow chauffeuring is the main cause of sudden cardiac death during physical activity. So you can see if with increasing the demand on oxygen due to dynamic exercise or static exercise will precipitate these events. So once happened, because this is an electrical disorder, the best treatment is by early electrical shock. So bystander CPR is very important, particularly with early defibrillation by AED. So don't wait for the medical personnel to come. If you know CPR, if AED is around, it's very easy to use, and this is help to save lives. Here's a strip describing how the AED work. It will be self-advisory for when to give a shock. So after speaking all those risky or tragedy outcomes, should we exercise at all? Is it safe to do so? So actually, it's long been known that the more frequent we do exercise, actually we have less chance of a heart attack. But on the other hand, when one exercise, the risk actually increase during or soon after exercise. But that does not preclude us from exercise, because it still helps us in preventing heart disease for even in healthier subjects or even in people with heart disease. If they are able to do more exercise, their chance of survival is better. So the balance is if one have to start a very strenuous exercise, particularly if they're older individual, they may need to go through some review first, medical review first, and for other people, maybe do a better warm-up and do a gradual increase in activity. And for people with a coronary artery problem, they better take cholesterol-lowering drug and aspirin. So in conclusion, I would say that the sports-related sudden cardiac death is infrequent, and most of them actually had underlying heart disease. For younger victims, hypertrophic cardiomyopathy is the leading cause of those events, and for the older ones, coronary artery atherosclerosis is the major cause. And at the time of cardiac arrest, they are usually due to electrical abnormalities, what we call ventricular tachycardia or ventricular fibrillation. Bystander CPR and the use of AED will save lives. So even though we know that exercise temporarily increases the risk of cardiac death, but the benefit of exercise still outweighs this risk. Thank you.